Well, adult immunisation is important because we're all getting older. And there's enough evidence now to say that that's true, that we can show that. That's good news. So the good news is we're all living longer, we're all getting older. But the bad news, of course, is that we're all going to have to work longer. Therefore, we have to be healthy. But there is another good news story to this, in that we've got the opportunity to play more too as we get older. We want to be part of society. I'm talking me, we want to be part of society. Yeah, okay, I'm getting old too. And I think because I am getting old, I'm more inclined to think about adult vaccination. And one of the things is that if you have healthy people, they don't go to their doctors. They don't need to go to their doctors. Why would you just to get a vaccination? Pneumococcal infections caused by Streptococcus pneumoniae are a key thing for adults, along with tetanus and other diseases. But pneumonia is one of the biggest things that the adult population needs to consider. And as we get older, we need to think about that.
We know from good economical statistics that the European burden per year is about 10.1 billion euro, and this means that we have 2.5 to 3 million cases of community-acquired pneumonia in Europe, and about 30% of these patients, and that is the majority of the costs, are treated in the hospital.
Well, we are told that we need to eat well, we need to exercise, and I would add to that, we need to do the simplest thing, which is to get vaccinated against the diseases that we're likely to come across.
Vaccination in all people in Europe in the age above 50 years. We know, and you see the data here, that we have in more than 60% vaccinated against tetanus, diphtheria, and maybe also pertussis in the same vaccine. We have about 49%, and these are data from 8 European countries, more Western countries. And then we have only 10% of vaccinated against pneumococcal infections. That is, I think, a very frustrating number. I think it's very important, and the GP who is seeing the patients regularly, he should also, I think, educate his patients that after the age of 60, the risk for a pneumococcal pneumonia is very high, and they have a measurement in their hands that is an active vaccine, and they should use it.
You could say that adult immunisation was the Cinderella issue of healthcare because nobody talks about it. It's almost like it's swept away because of all the other things that are out there that are more important. Diabetes, obesity, heart disease, don't smoke, don't drink. Many of these things have loud voices within the advocacy community. Immunisation, especially adult immunisation, does not have a champion, does not have a voice. And personally, I would like to change that.